Hello, my name is Kaylia Myers, and for this research project, I'm going to be talking about post-traumatic stress disorder. Throughout this presentation, I'm going to go through a PowerPoint that I created, and I am going to do kind of like a voiceover going through the PowerPoint. Throughout the PowerPoint, there's going to be a lot of information. I also included a short YouTube video for us to watch, and also towards the end there is going to be a learning activity for everyone to do, and you will just have to pause the video and you can do the activity and then just play the video when you're done.
Today, we are going to be talking about post-traumatic stress disorder. So this is considered an emotional or behavioral disorder. To start off with, we are going to read this quote. According to the National Center for PTSD, about 7 or 8 out of every 100 people will experience PTSD at some point in their lives. Women are more likely to develop PTSD than men, and genes may make some people more likely to develop PTSD than others. Now, when you first hear this quote, it might not mean much to you. It might just seem like a fact or simply just another statistic. But in reality, as future educators, it is going to be important for us to know about these different emotional and behavioral disorders, as it might come in use as to when we are in the classroom. So there's going to be a few different reasons as to why we should learn about this. So as a future educator, it is going to be important for us to learn about all the different emotional and behavioral disorders, but also more specifically post-traumatic stress disorder or PTSD, because we may come across a student who has it in our very own classroom. Also, when we know that what PTSD is and some signs or symptoms, we may be able to notice if a child may have PTSD. And then we can point them to someone who may be a more help to them, or we can point them towards some more helpful resources. And you never know, there might always be a case where you might have a child in your classroom and you might see them exhibiting some of the signs or even symptoms of PTSD, and they may not even know they have it. It is also important to know how we can help them in the classroom so that they are set up to succeed no matter what emotional or behavioral disorder they may have. So this purpose is not is not specifically just for post-traumatic stress disorder. It's going to be for any emotional or behavioral disorder. We are going to go over some learning objectives. So by the end of this presentation, we are going to be able to accurately define post-traumatic stress disorder. We are going to be able to identify and name some of the symptoms that can be presented with PTSD. We are going to be able to identify the different treatment methods to help someone suffering from PTSD. And we're also going to be able to list possible classroom interventions for someone who has PTSD. So we are going to talk about and discuss more than just what is listed in the learning objectives, but these are going to be the 4 main things that you are going to want to remember and are going to be most helpful while you're in the classroom. Everything is going to be important, but these are going to be the top 4. So before we go into more depth of what post-traumatic stress disorder is or PTSD, we are going to go over some vocabulary. These are just going to be some things that you want to know what they mean, just because they are going to come up a lot with post-traumatic stress disorder. And also, they may come up with a lot of other emotional or behavioral disorders. So, firstly, you really want to know that PTSD is post-traumatic stress disorder. Oftentimes, post-traumatic stress disorder is going to be abbreviated to PTSD just because it is going to be shorter and it's going to be easier to say when talking about it. So you will hear post-traumatic stress disorder referred to as PTSD. It's also important to know that post-traumatic stress disorder is an anxiety disorder that a person may develop after a traumatic or dangerous event. Now, this is just like a brief definition of what PTSD is. We are going to go into more detail further we get into this presentation. It's also important to know what trauma is. Trauma is going to be an emotional response to an event. It's also important to remember that everyone is going to have their own emotional response. So two people may experience the same exact event and they could have two different emotional responses to that event. So it is important to just remember that. It's also important to know what a risk and resilience factor is. So a risk factor is going to be things that make a person more likely to develop a disorder. And then a resilience factor will be things that can help reduce the risk of a disorder. So we will discuss that further into this presentation, but in any other emotional or behavioral disorder, it is important to know the difference between risk factors and resilience factors. We're now going to get more into what post-traumatic stress disorder is. So post-traumatic stress disorder, also known as PTSD, is a disorder that some people may develop after experiencing a traumatic or dangerous event. PTSD was first recognized in veterans and gained the name shell shock. But now PTSD is being diagnosed in a wide range of people, so it's not only veterans or soldiers. Back then, when it got the name shell shock, they were first really only diagnosing it in veterans. They didn't really diagnose it in anybody else, but now PTSD can be diagnosed in any person of any age, really. Many people will experience a range of symptoms after a traumatic or dangerous event. However, most of those people are going to recover from those symptoms on their own. A lot of people, after a traumatic or dangerous event, you will see some signs and symptoms afterwards, but oftentimes they will recover on their own. But there are going to be those people who do not recover on their own and they continue to have those symptoms, which could then lead to them being diagnosed with PTSD. Now we're going to watch this short video about post-traumatic stress disorder.
Many of us will experience some kind of trauma during our lifetime. Sometimes we escape with no long-term effects, but for millions of us, those experiences linger, causing symptoms like flashbacks, nightmares, and negative thoughts that interfere with everyday life. This phenomenon, called post-traumatic stress disorder, or PTSD, isn't a personal failing. Rather, it's a treatable malfunction of certain biological mechanisms that allow us to cope with dangerous experiences. To understand PTSD, we first need to understand how the brain processes a wide range of ordeals, including the death of a loved one, domestic violence, injury or illness, abuse, rape, war, car accidents, and natural disasters. These events can bring on feelings of danger and helplessness, which activate the brain's alarm system, known as the fight, flight, freeze response. When this alarm sounds, the hypothalamic, pituitary, and adrenal systems, known as the HPA axis, work together to send signals to the autonomic nervous system. That's the network that communicates with adrenal glands and internal organs to help regulate functions like heart rate, digestion, and respiration. These signals start a chemical cascade that floods the body with several different stress hormones, causing physiological changes that prepare the body to defend itself. Our heart rate speeds up, breathing quickens, and muscles tense. Even after a crisis is over, escalated levels of stress hormones may last for days, contributing to jittery feelings, nightmares, and other symptoms. For most people, these experiences disappear within a few days to 2 weeks as their hormone levels stabilize. But a small percentage of those who experience trauma have persistent problems. sometimes vanishing temporarily, only to resurface months later. We don't completely understand what's happening in the brain, but one theory is that the stress hormone cortisol may be continuously activating the fight, flight, freeze response while reducing overall brain functioning, leading to a number of negative symptoms. These symptoms often fall into 4 categories: intrusive thoughts, like dreams and flashbacks, avoiding reminders of the trauma, negative thoughts and feelings like fear, anger, and guilt, and reactive symptoms like irritability and difficulty sleeping. Not everyone has all these symptoms or experiences them to the same extent and intensity. When problems last more than a month, PTSD is often diagnosed. Genetics, ongoing overwhelming stress, and many risk factors like pre-existing mental illnesses or lack of emotional support likely play a role in determining who will experience PTSD. But the underlying cause is still a medical mystery. A major challenge of coping with PTSD is sensitivity to triggers, physical and emotional stimuli that the brain associates with the original trauma. These can be everyday sensations that aren't inherently dangerous but prompt powerful physical and emotional reactions. For example, the smell of a campfire could evoke the memory of being trapped in a burning house. For someone with PTSD, that memory activates the same neurochemical cascade as the original event. That then stirs up the same feelings of panic and helplessness, as if they're experiencing the trauma all over again. Trying to avoid these triggers, which are sometimes unpredictable, can lead to isolation. That can leave people feeling invalidated, ignored, or misunderstood, like a pause button has been pushed on their lives while the rest of the world continues around them. But there are options. If you think you might be suffering from PTSD, the first step is an evaluation with a mental health professional who can direct you towards the many resources available. Psychotherapy can be very effective for PTSD, helping patients better understand their triggers. And certain medications can make symptoms more manageable, as can self-care practices like mindfulness and regular exercise. What if you notice signs of PTSD in a friend or family member? Social support, acceptance, and empathy are key to helping and recovery. Let them know you believe their account of what they're experiencing, and that you don't blame them for their reactions. If they're open to it, encourage them to seek evaluation and treatment. PTSD has been called the hidden wound because it comes without outward physical signs. But even if it is an invisible disorder, it doesn't have to be a silent one.
So after watching this video, it does kind of dive into what PTSD is, and it explains it in a way that can be better understood, and it goes more into depth about the chemical imbalances within someone's body when they are experiencing PTSD. It also talks about how something like a campfire can be a trigger to someone if they were in a house fire. So it's simple things like that that can be a trigger to someone who does have PTSD. Another thing within this video, it did say that PTSD is considered like a hidden wound. So most times you cannot see it on a person physically by how they look. Usually it's something they are dealing with within themselves. So a lot of times you may not see someone dealing with PTSD if they are keeping it all inside, and other times you may see someone dealing with PTSD. But that video just kind of gives an explanation just so we all can kind of have an understanding of what PTSD is. So now we're going to go into it more further and learn about some of the signs and symptoms, causes, treatments, and things like that. So we are going to talk about the different types of PTSD. So when I refer to the different types of PTSD, they're not necessarily different kinds. These are going to be names they refer to, or almost categories that you can be put into, and it just kind of depends on when your PTSD started, like your symptoms, things like this. But these are going to be more so categories. So first, there's going to be delayed onset PTSD. So you would be put in this category if your symptoms emerge more than 6 months after experiencing a trauma. Then there's going to be complex PTSD, and this will be if you experience trauma at an early age or if it lasted for a long time. There's going to be birth trauma. This is if you experience a traumatic childbirth, you could develop PTSD. And then there's going to be secondary trauma. So this one is if you experience some PTSD symptoms while supporting someone close to you who's experienced trauma. This one basically means if you are close to someone who experienced some traumatic event or some dangerous event, you may develop some PTSD from it. But like I said, these are more going to be considered categories in which they might put you in depending on what your PTSD is like. And now we're going to go into the causes of PTSD. There are many things that can cause a person to experience PTSD. In most cases, the person who experienced an event that was traumatic or dangerous in some way. Not every person is going to develop PTSD after experiencing a traumatic or dangerous event. They're still trying to find out why some people develop PTSD and why some people don't. But as of right now, they don't really have an exact reason as to why some people do and why some people don't. The events that a person may experience is going to vary from person to person because everyone is going to have their own unique experience. This kind of relates to what I said earlier. One person may experience the same trauma or traumatic event as another person, and they both could have different experiences afterwards, which could lead to one person developing PTSD and the other person not. Like I said, it's just going to vary from person to person. It's also going to be important to remember that not everyone who experiences an event like this will develop PTSD. Some people will, some people won't. So that's why you kind of have to look at the signs and symptoms and how long they're lasting. So potential causes, like I said, a traumatic or dangerous event is what's going to cause someone to develop PTSD. So examples of something that might be considered a traumatic or dangerous event could be a car crash, it could be assault, abuse, harassment, bullying, experiencing violence, secondary trauma, surviving a natural disaster, losing someone close to you. It could also be something like divorce. If a young child sees their parent go through a divorce, if it's not a very good divorce, if it is a bad divorce, they could develop PTSD from it. You can really develop PTSD from a lot of things because depending on the person and what they go through, they may consider something more traumatic than another person would. So now we're going to talk about factors. So like I stated at the beginning, it is important to know the difference between risk factors and resilience factors. So we're going to start off with risk factors. So these are going to be things that will be more likely to develop. So someone who lives through a dangerous event or trauma, getting hurt, childhood trauma, feeling horror, helplessness, or extreme fear, having little or no social support after an event, dealing with extra stress after an event, or having a history of mental illness or substance abuse. These could be things that might lead you to being more likely to develop PTSD. For resilience factors, like I said, these are going to be things that help reduce the risk. So seeking out support, this could be from your friends or your family, finding a support group, and even having a positive coping strategy. So a way to help you get through a bad event or even a way to help you learn from an event you experience. These are going to be things that can help you reduce the risk of you developing PTSD. But even if you do all these things, there is still a chance that you could develop it, but these will help you reduce the risk. And then we just have some other factors. So researchers are still studying the importance of these when it comes to PTSD. So things like genetics and neurobiology. Kind of like in the video how it stated, they don't know why some people get PTSD and why some people don't, even if they go through the same exact event. Things like this are still being studied. So as of right now, they don't have an exact reason as to why some people develop PTSD and why some people don't. They are still studying it, and same with genetics and neurobiology. They are studying that and how it does relate to PTSD. Now we're going to move on to like signs and symptoms of PTSD. So as future educators, we are going to be around more children and even teenagers depending on what grade we are teaching. So some signs, just some common, almost like generic signs you might see of PTSD would be nightmares, insomnia, increased irritability, withdrawal from people in even the world around you, difficulty with school, and even depression and anxiety. These are going to be more of the almost like generic symptoms, so very common, and these are going to be signs that you just think of first when it comes to PTSD. When it comes to symptoms, there's actually going to be 4 different categories of symptoms. So if you see someone with PTSD, their symptoms can fall under these 4 categories. So there's going to be re-experiencing symptoms, avoidance symptoms, arousal and reactivity symptoms, and then cognitive and mood symptoms. So to start off with re-experiencing symptoms, this is going to be things like flashbacks, bad dreams, or even frightening thoughts. Avoidance symptoms are going to be staying away from places or events that are reminders of a traumatic or dangerous event that you experience, or even avoiding thoughts, feelings that are related to a traumatic or dangerous event. These type of symptoms are basically in the name, so anything that you try to avoid or stay away from. Arousal and reactivity symptoms would be easily startled, feeling tense or on edge, difficulty sleeping, or even angry outbursts. And then we have cognitive and mood symptoms. So this could be trouble remembering features about the event, negative thoughts about oneself or the world, distorted feelings, so things like guilt or blame, and then loss of interest in activities. So now that we kind of went over the different categories of symptoms, I'm just kind of going to go over an overview of possible symptoms. So some possible symptoms could be agitation, denial, disorganization, distress, flashbacks, withdrawal, nightmares or sleeplessness, and hopelessness, and even detachment. So something I did not list in this present or in the PowerPoint are going to be some age specific features of PTSD. So for very young children, so around the age of 5 or younger, few symptoms are reported because of the need of verbal descriptions. A lot of young children, they don't have the abstract thinking yet or vocabulary to describe how they are feeling and what they're going through. So that's why there are few symptoms reported. Their fears are going to be more generalized, and so are their anxieties. They may have sleep disturbances, kind of like nightmares. They may also have regression when it comes to their development. And they may also have post-traumatic play, which recreates the trauma or general themes of the trauma. For children ages 6 to 11, so the elementary age children, When they talk about the event, they might put the event in the wrong order. You might see a lot of withdrawal or acting out. They may also have trouble concentrating and have trouble in schools. You might hear a lot of physical complaints, so like headaches or stomach aches. And they may also try to reenact the trauma they went through playing, drawings, or words. And you may also see some regression in them. And then in adolescence, so this is going to be ages 12 to 17. These ones are going to be more closely related to adult PTSD. So how you see PTSD presented in adults, adolescents will present it very similar, not exactly the same, but very similar. So they may have guilt, suicidal thoughts, flashbacks, depression. Some might have substance abuse. They may have problems with their peers. They may act out or have antisocial behavior. And they may even have aggression. But like I said, these features that are related to their age, it's going to vary from person to person. So not every person that age will exhibit the same signs and symptoms. Now we're going to go into treatments. So after being diagnosed with PTSD, there are a few different treatment options one could go with. So first, there's psychotherapy. This type of therapy will allow the person to talk, draw, play, or write about the event that happened to them. This is a good way for them to kind of get out what they are feeling and just to let everything that is kind of building up inside out. Next, we have cognitive behavioral therapy. This type of therapy can help a person learn to change their thoughts and feelings by focusing on their behavior first. So what this basically means is when it says focusing on their behavior first, it's going to talk about how they may show fear or be scared. So when they focus on that first, they can learn to change their thoughts and how they're feeling by focusing on what got them to that point of how they're behaving. And then we have medications. So this can be used to help decrease the symptoms a person may be experiencing. The most common medication people with PTSD are prescribed are antidepressants. This is going to help with like the depression they may be having. There are also a lot of other medications that can be described. Most times it's just going to depend on your symptoms. So if you're having trouble sleeping, you might have a medication prescribed to you to help with that. And then next we have classroom interventions. So no matter what emotional or behavioral disorder you talk about, it's going to be important to have some classroom intervention plans in place just in case you are put in that position where you do have a student who has that emotional or behavioral disorder. So for PTSD, you want to teach stress management techniques and even social skills. You want to be flexible with routines. You want to teach coping and relaxation skills. This is going to be very helpful depending on the person. You want to reassure the student and provide support. Support is going to be a very big thing that's going to be very beneficial. You want to allow the students to feel their own emotions. Oftentimes, students and children especially, when they feel a certain type of emotion, they're oftentimes told they're not allowed to feel that way or act that certain way. It's important to let them know that it is okay to be feeling the way that they are. You want to provide a safe environment. You want to provide a calm and safe place for the student to go if needed. This could be like a safe place, or you can even have a designated corner or spot in your room for students to go if they just need a little bit of time by themselves. You want to be aware of cultural differences. You want to learn the students' triggers and try to avoid them. So for this one, it may be hard to learn what triggers the students' symptoms. But you can do this by observing them, or some students may feel comfortable enough to let you know what things may trigger them. And if that's the case, you want to try to avoid them in the classroom as much as possible. Encouragement and reinforcement strategies, and even giving the students choices and allowing them to work on decision-making skills. These are just going to be some classroom interventions you can do with someone who may have PTSD, but it might also be a trial and error thing to see what works best with that specific student. And then next we have this learning activity. Then I'm going to make this full screen. So at this time, if you would like, you can pause this video if you would like to do this learning activity. For this learning activity, there are just a few questions. This just kind of goes over the things that we discussed. So what is PTSD? What is the cause of PTSD? List 6 symptoms you might see with PTSD, 3 different treatment methods, and 3 different classroom interventions. So at this time, if you would like to do this learning activity, you can pause the video now. And then when you are ready to kind of check your answers, you can unpause it. So now I'm going to kind of go over what the answers would be if you did complete this activity. So what is PTSD? So PTSD is going to be an anxiety disorder that someone may develop after experiencing a traumatic or dangerous event. And everyone with PTSD is going to experience something different, and their PTSD will be shown in different ways. What is the cause of PTSD? So there's no exact cause for PTSD. It's just going to be a traumatic or dangerous event that someone does experience. Not every person who does experience a traumatic or dangerous event is going to develop PTSD, but some people will. So the cause is basically just a traumatic or dangerous event. The 6 symptoms you might see with PTSD. So 6 symptoms you might see could be irritability. They might not be able to sleep. They might seem withdrawn from the world around them. They might have flashbacks. They may be depressed or have anxiety. They might have nightmares. They might start to feel lonely. They might be aggressive. Things like that. There is quite a number of symptoms that can be seen. So the 3 different treatment methods would be psychotherapy, medications, and then even cognitive behavioral therapy. So the 3 different classroom interventions, like I said, kind of similar to the symptoms. There are different ones that you can have. So there's not necessarily no right or wrong answer for this one. But just to list some, you can teach them stress management techniques. You can provide them with a safe and supportive environment. You can learn what may trigger them and try to avoid that. You can provide them with support, allow the students to make their own choices so they feel like they have some control, reassure the student, accept their behavior and how they're feeling, things like that. But this learning activity kind of goes over some of the main points that were discussed in this presentation. So if we go back over to our PowerPoint, and we kind of have to skip a few. We're going to just kind of go over the overview. So this is going to be like what we learned. So post-traumatic stress disorder is an anxiety disorder that some people may develop after going through a traumatic or dangerous event. A traumatic or dangerous event can cause some people to develop PTSD, but that does not mean every person who goes through something traumatic will develop it. There are certain factors that may make a person more susceptible to developing PTSD, and there are factors that can help reduce the risk of a person developing PTSD. There are a variety of symptoms that a person may experience with PTSD, and those symptoms are going to vary from person to person. There are a few different treatment methods like psychotherapy, cognitive behavioral therapy, and medication that a person can use to help with their PTSD. And finally, classroom interventions are going to be key in helping a student with PTSD succeed inside and even outside of the classroom. And then here are just kind of the references. So this is where I did obtain my information, but that is all we are going to learn about PTSD. But like I said, this does cover a lot of the main points, and this is going to be some helpful and beneficial information when it comes to us as future educators.